You may have heard of the term minimal stimulation IVF or mini-stim IVF. It's also sometimes referred to as patient-friendly or gentle IVF. At Marin Fertility Center, we call it moderate IVF. But all of these names are interchangeable, and they all describe the concept of purposely trying to target the retrieval of a smaller quantity of eggs than is typical with IVF. Now, this may seem kind of odd at first because what we learned quickly over 40 years ago with the advent of IVF is that we need more to do more. That is to say that the more eggs we retrieve, the better chances we have to create that one embryo that has the potential to develop into a baby, for we know not all embryos do. So a strategy that purposely tries to get less may seem counterintuitive on the surface, but digging a little deeper, we can understand why this may be the preferred pathway for some patients. So first, let me explain how moderate IVF works by focusing our attention on the one portion of the assisted reproductive process where it differs from conventional IVF, and that's the ovarian stimulation phase. Sometimes we call that controlled ovarian stimulation, or COS. During ovarian stimulation, we use medications, most often injectable medications, to promote the growth of multiple follicles at the same time. Now, normally the end result is a significant number of eggs, let's say on average 8, but some women who are fortunate may be able to grow numbers in the double digits, that is 10 or more in a single month. Remember, naturally the ovary defaults to the growth of a single egg per month. So, to get back to the why would we purposely want to target less eggs in a treatment cycle if the general concept is the more the better? There are 3 main groups of patients that may want to consider this, and I'll discuss them in order from most frequent to least frequent. The first group would be women who are of advanced reproductive age. That is to say, statistically, they are nearing the age when they will no longer be able to conceive. Sometimes the patient simply can't mount the kind of physiologic response that leads to the growth of a significant amount of eggs. For their ovaries, perhaps 2, 3, 4 eggs is all they can make, no matter what the strength of the medications that we give. Those patients would be a good match for moderate IVF because we are matching a treatment strategy to the reality of their individual physiology. The second group I would see a match to in terms of moderate IVF would be at the other extreme of age. Very young patients, let's say 32 or less. Let's use as our example a young person who has no identified infertility diagnosis that is affecting her egg supply or quality. Let's say she has a male factor, a partner with a problem, or she has a tubal factor. This patient may not need a large quantity of eggs because based on her young age, we are expecting her eggs to be of high quality. They're so robust that we can ease up on the conventional drive to get as many eggs as possible in a single month. She may not need more than 5 or 6 eggs to get a baby. One noteworthy exception to this being a perfect match is that in the patient I just described, if she wants more than 1 baby, then working with less eggs may not be optimal. It's important to factor in lifelong goals always when selecting treatment strategy. Also, pursuing something like PGTA would not be a good typical match because we just get into economies of scale. When working with high-end technology, we don't want to send through analysis a truncated group of eggs. The third and final group, and this is a much less common group, would be a patient that has a specific contraindication to ovarian stimulation. Side effect concerns, maybe medical conditions, past ovarian stimulation history, family history. These are all things to weigh in when deciding if moderate IVF is a good match. One final note, in all the above situations, we are generally using lower doses of injectable ovarian stimulation medications. In fact, for some women fortunate enough to have an exquisitely sensitive response to ovarian stimulation, oral medications, either alone or in combination with injectables, can always be considered.